I'm Dr. Monica Christmas, Director of the Menopause Program and Center for Women's Integrated Health at the University of Chicago Medicine. This week, I've been asked a lot about what does removal of the box warning mean for hormone therapy? Does it mean that hormone therapy is safe for everyone and doesn't confer any risk? Well, that part isn't true. The box warning was initially put in with hormone therapy to create a pause for patients as well as physicians to understand what the associated risks with hormone therapy might be. There's two classes of hormone therapy. There's local low dose vaginal estrogen that helps to treat things like vaginal dryness, vaginal irritation, potentially pain and or bleeding with any type of vaginal penetration like sex, as well as urinary urgency and frequency. And although it doesn't treat urinary tract infections, for people that postmenopausal women actually that are having recurrent urinary tract infections, it can help minimize the risk of recurrence. And so everybody across the board really felt, based on good evidence, that local low dose vaginal estrogen is very safe, highly effective, and the black box warning was probably overkill and should not have been included. And potentially may have been a deterrent for some people because their doctor may have told them that it was safe to use, but then when they went to pick it up for the pharmacy, they'd see that warning and be scared. And what did that warning say? The warning said that use of hormone therapy potentially might be associated with an increased risk of cardiovascular disease or breast cancer. And that's not true for local low dose vaginal estrogen, but for higher dose systemic hormone therapy that you would use, for example, for managing hot flashes and night sweats, that you would use to help improve bone health and reduce the risk of osteoporosis, as well as it's used in individuals who undergo premature or early menopause to mitigate any cardiovascular or cognitive risk. Using systemic hormone therapy could increase risk in some certain individuals. So, if somebody that has an underlying history of cardiovascular disease or had an estrogen derived cancer, for example, like some breast cancers, those would be contraindications to systemic hormone therapy. For individuals that are under the age of 60, close to the onset of menopause, the risks are pretty minimal, but I can't say that they're zero. However, in older women that are over the age of 60 or more than 10 years from the onset of menopause, those risks increase. And that's what that black box warning did. It created that pause for patients to say, oh my goodness, doctor, what does this mean? And then it gave the opportunity for healthcare professionals to do a thorough counseling of their patients about what the potential risk and benefits might be of being on systemic hormone therapy, including personal history, family history, age since menopause or age of onset of menopause, and time since that last menstrual period as points for consideration when deciding whether hormone therapy is right for that individual or not. The decision to start hormone therapy is one that should be made with your healthcare professional, incorporating what symptoms you're experiencing, your age, time since the onset of menopause, and any other family history or underlying medical conditions that you might have that might make you at an increased risk. The good things to know is that no one has to suffer. Even if hormone therapy ends up not being an appropriate choice for you, there are a number of other effective treatment options to help mitigate any symptoms that you might be experiencing.